The UNICEF Pakistan Country Program 2018-2022 is aligned. UNICEF goals in Pakistan works for every child survives and thrives, every child learns, every child is protected from violence and exploitation, and every child lives in safe and clean environment. In Pakistan, there are 6 goals for water, for education, nutrition, child protection, health, and polio. Under these goals, the main challenges for water, sanitation, hygiene is to ensure a safe, clean community with adequate water, sanitation for every child. Education, every child has the right for education, child protection, nutrition, and polio, for eradicating polio in Pakistan by reaching every child with polio vaccine. Our supporters for this are mainly the UNICEF, followed by the government, that includes different countries including Pakistan and other Asian and European countries, national committees, non-government organizations like Gavi, and Bills and Melinda Gates Foundation, and IKEA Foundation. Coming up to the health, for every 1,000 babies born in Pakistan, 42 die as newborns and 62 as infants. 75% of newborn deaths are caused by 3 preventable and treatable conditions: complications due to premature birth, complications during labor and delivery. And as you can see that only 1.1% of the GDP has been spent on nutrition, whereas the recommendation is 5%. And the main cause for this high infant mortality, that the poor access to immunization and low quality of maternal and newborn care services. And only 75% of children are Penta 3 vaccine, that is the standard for checking the vaccination coverage. For this response, under the UNICEF, there are several programs for maternal and newborn child health, MNCH, routine immunization program, EPI, Global Action Plan for Pneumonia and Diarrhea, and prevention of parent-to-child transmission of HIV. Now coming to polio, Pakistan is one of the 3 remaining polio endemic countries, including Afghanistan and Nigeria. And the polio eradication program started in 1994. Till the new programs, polio has reduced the polio cases from several hundreds to only 8 cases in 2019. Total of 83 cases were reported in 2020, and 121 cases of vaccine derived polio reported in 2020. So in 2020, 83 cases of wild polio were reported in Pakistan, and a decline from 147 in 2019. As you can see from the figure that by UNICEF, 302 million doses of polio vaccine by the door-to-door regime and also at the centers was provided. And half of the 0-dose children referred through integrated service delivery received routine vaccinations. This was the campaigns mostly held. Door-to-door campaigns are encouraged in Pakistan and are held by UNICEF. So there has been tools and approaches under the National Action Plan of Pakistan Polio Eradication Program, NEAP, that has recently been introduced, and its program aims at zero polio in Pakistan. And it implements the vaccination schedules to ensure maximum vaccination coverage for vulnerable children. Now coming to the nutrition, nearly 10 million Pakistan suffers from stunting. And as reported by the annual report of UNICEF, only 38% of children are exclusively breastfed. And 8 out of 10 children of Pakistan do not eat good type of food. So there was a national nutritional survey in collaboration with UNICEF, and the situation of nutrition in Pakistan is quite problematic, and problems of malnutrition are common, like 40% of children are stunted and 28.9% are underweight. For this, in response to this problem, there were several programs initiated by UNICEF. One is institutionalization nutrition services, better nutrition and home, STG linked with the water sanitation and hygiene, named as WASH strategies. Also, there is an early childhood developmental program, and scaling up nutrition initiative that includes right to food and good nutrition for all children. And there is also a community management of acute malnutrition program to the government. Overall, you can see that the acute and chronic malnutrition has a problem, and many children are suffering from this is a huge number of 88% children are severely acute malnourished. Also, for this reason, as a part of a campaign, vitamin A supplementation was started. Doses were given with the normal polio doses, and 27.3 million children were protected through these doses. During COVID 19, 14 million children and mothers received COVID safe nutrition services, and mostly through the awareness was raised through social medias, including radio, TV audiences, including the community of 1.3 million people. Now, for the education, it is estimated that 22.8 million children aged 5 to 6 are out of school in Pakistan. And the reason for this was and there were 42 million children whose schooling was interrupted by COVID-19. There are several disparities that are causing these differences in education. For example, disparities based on gender, socioeconomic status, geography are significant, especially in Sindh and in Balochistan, where 78% of girls are out of school. And nearly 10.7 million boys and 8.6 million girls enrolls at primary level, and this dropout of 3.6 million boys and 2.8 is a quite high number of dropouts as well. So the cumulative education expenditures must be increased, and it could be the one of the reasons for not having good education system or level in Pakistan. And due to COVID, several education systems have been shut down due to technologies and no tech support. And it's around 8 million students. So the total GDP of 1.5% is was given to the education, as compared to 2.3 in 2019 to the Economic Survey 2020-21. So for the educational programs, with collaboration to UNICEF, there is an early childhood education program. There is expansion of equitable quality alternative learning pathway that involves the basic education level nutrition, and there is also an adolescent developmental program. Water sanitation hygiene, there has been a wash strategy to improve the hand washing practices at schools, provision of water, and provision of all type of hand hygiene equipments. So it had 4 goals for ending open defecation, improve quality of water, wash in schools, and wash in emergencies. So with the spread of COVID-19, wash services in the health facilities, schools, and communities, and promotion of hand washing with soap have gained new importance for infection prevention and control. That is already known. These are also the figures showing that Pakistan has responded well in response to this war strategy, with 20 cities cleaned up to compete with Clean Green Pakistan Index, 1.4 million people having safe and so on, and 9.5 million people availed hand-free washing facilities. So it was a good step from Pakistan. Coming to the child protection, there is a lack of child protection services and registries, proper registration with NADRAs, and it's causing a lot of problems. So children in Pakistan remain vulnerable to violations of right protections, violence, exploitation, abuse, and child labor. And children are 40, and a large number of children are only 42.2% are registered, and remaining are not registered in Pakistan. There are several recently there have been several ceremonies for the child protection services in different areas of Pakistan with collaboration to UNICEF, and they have initiated that every child's need identity. So under this program, the child registration systems is improving, protecting child from violence and abuse, and partnerships of child protection with Awaz to UN joint program, also with UN women functions with NADRA, local governments and health departments, so that to ensure that children born in hospitals are registered at birth. And the natural disasters are also being taken under cover by this in collaboration to this UNICEF, with including the different climate changes, including the downing fires, snakes, insects, bites, etc. This was the whole financial highlights how much donations and how much funding was given from the regular and other sources, and for education and for nutrition and for health. And It was all by donations and contributions by the other facilities. So coming to the recent updates, this was the report by UNICEF that Pakistan steps up COVID-19 rollout with UNICEF supports of government's drives to ensure an effective and efficient complaint rollout COVID-19 campaign. And they said that we help the government produce essential COVID-19 routine immunization and polio supplies with expand chain capacities for adherence to COVID-19 safety measures. And there was also visit for the president by the UNICEF. So there was another that the WASH strategy was implemented and the impact was seen. And by this paper, the findings showed that for services, 58% water, 19.3% sanitation, and 13% hygienic services were most of the facilities has these services in this ratio, so it was a good percentage, but still it needs improvement. So now coming to the MCQs, uh, starting from the basic, the organization that provides a long term humanitarian and development assistance to children and mothers in developing countries is mainly maintained by, any idea?
UNICEF.
Yes, it's UNICEF. Starting from basic, according to UNICEF report 2018, which nation is the riskiest for the newborn? Is Iran, Pakistan, India, or Nepal?
Pakistan.
Yes, it's Pakistan. Third is Pakistan, one of the three remaining polio endemic countries in the world, along with Afghanistan and Nigeria. In Pakistan, the decline of cases for approximately several hundred every year to only 83 cases in 2020 was achieved. Most recently, under which of the following program? National Emergency Action Plan of Pakistan, NEAP, the Global Polio Eradication Initiative, Polio Plus Polio Immunization, and Polio Pakistan. Recently, which program is being?
B.
D.
Recently, the National Emergency Action Plan of Pakistan for polio eradication was the plan, and under this action plan, the cases of polio were highly reduced. The Sun movement is working to achieve sustainable and equitable reduction of malnutrition and nutrition justice for all. The scaling up of nutrition movement is a renewed effort to eliminate all forms of based on the principle that nutrition programs at schools include providing free lunch and meals. Everyone has the right to food and good nutrition, better nutrition at home, improving water, sanitation, and hygiene.
D.
B is the right answer. Everyone has the right to food and good nutrition. Child Protection Program is a technically supporting the government of Pakistan to strengthen realization of rights of child protection. Forms of violence and exploitation because of fundamental absence of child protection. Which of the following can most help make Pakistan a safer place in terms of child protection? Partnership with NGOs and private firms, raise awareness against domestic violence, improves digital birth registrations with NADRA, educate children about child rights via school curriculum. C is the answer. As I've already told, that whenever the children would be registered, their data would be available and it would be easy to access the child, access the family, and it would be a better chances of improving the child protection services in Pakistan. In order to improve the overall education of children in Pakistan, several programs are being run in collaboration with UNICEF. To increase the provision of education at basic levels, nurturing the school communities, linking to increase on-time enrollments, reduce dropouts, and ensure completion and transition for all students. These are all best fit in which of the following program? Early childhood, quality alternative learning pathways, adolescent development, the career and technical education. Any idea? B is the right answer. The quality alternative learning pathways is ensuring all these under this program. Which of the UNICEF, with the help of UNICEF, many countries are on track to achieve sustainable developmental goals. Which of the following statement defines one of the main goals of UNICEF in achieving the SDGs on the global platform? ensure healthy lives and promoting well-being at all ages, reduce half the proportion of people living on less than dollar a day, setting the standards for global health, ensure environmental sustainability.
B.
Yes, B is the answer, that it one of the goals is to reduce the half of the proportion of people living on less than dollar a day. According to the recent Pakistan Annual Report 2020 by UNICEF, Pakistan is ranked on top of chart of infant mortality. Is quite high. Which of the following statement is the main cause for such high mortality? Availability of vaccines in the country, poor access to immunization and low quality maternal newborn services, refusal of getting the child vaccinated by some ethnic groups, and resistance to disease virus to the currently available vaccines. It's B.
B.
Yes, it's B. Poor access to immunization and low quality maternal and newborn services. School plays an important role in promoting the health and safety of children and adolescents, and with establishing lifelong health patterns for its adults. Which of the following option contains the framework for addressing school health in the country? Place-based education model, early childhood education model, quality alternative model, or the a whole child model.
B.
Actually, the framework that is implemented on schools and addressing the school health in the country is the whole child model in collaboration with CDC. There has potentially been severe learning loss due to pandemic given to schools in Pakistan, and many schools were closed between this duration. A total of 42 million children experienced interrupted schooling during COVID, mainly due to in Pakistan, mainly due to psychological effect, connectivity and access to technology, uncooperative behavior of parents, and inexperience of teacher in distant teaching.
A.
Um, as by the report of 2020 by UNICEF, it was shown that connectivity, access to technology, or the availability of these technologies were one of the main reasons why most of the schools and children they have interrupted schooling. So it is B. This is the key. Here are the references, and thank you.
Thank you very much. Very nice presentation. And regardless of the connectivity issues that we today faced, it is a very wonderful presentation. I think there are no questions in the chat box, so I would like to finish the class here and see you tomorrow, inshallah.
Ma'am, thank you.